Okay, well, with that being said, let's do it. Welcome back to another episode of the Exploratory, where we explore all things related to veterinary medicine and well-being. And I am so excited to have a very special guest on with us today. His name is Dr. Charles Hurty, and actually have a really funny story that I'm gonna tell you guys to let you know how excited I am to have Charles on with us today. My name is Dr. Quincy Hawley, and I'm joined by my co-host Renee Michelle. What's up, Renee? How you doing? Nice to see you. Nice to see you, Renee. Are you excited about the show today?
I'm really excited. I was telling you guys in that our chat time is how over the moon I am to have Charles on. And for the students, what my part when I get to hear people's feedback when they're in Get Motivated University, I always want to shout it to the rooftops, but we respect people's privacies, and so we don't do that. And so I'm really excited for this conversation because the community, the Get Motivated community, the vet community, get to hear a little about Charles, and I get to hear even more about Charles. So I'm stoked.
Cool. Well, with that being said, Charles, welcome to the podcast, man. And go ahead and introduce yourself.
Sure.
Tell everyone like who you are, where you're from, and what your current role is in veterinary medicine at this time.
Yeah, you got it. And likewise, I'm super excited to be here in this forum with you all, able to talk with you. I've been listening to the programming for months and months, and to have kind of a two-way conversation is just awesome. And you guys, again, just a shout out to the two of you for following this dream and putting it together, because positive change is coming from it. So you guys are making a difference, and I'm sure all the students and everybody part of Get Motivated is there. We're all so happy for you all to be successful and to have a platform. So thank you. Yeah, I'm Charles Hurty. I'm a veterinarian. I graduated from NC State in 2002. Yeah. So I've been in the industry as a veterinarian for just over 20 years, which is really weird to think about, to have my name attached to that many number of years. But anyway, it's been a very fulfilling 20 years, let's say. But I'm also I'm a dad. I've got two kids, Claire and Ben, who are both teenagers and both driving. And we're looking for Claire to go off to college next year, which is, it's affecting me more than I thought it would, but but it's a big deal. Husband, I have Natasha, my wife. We actually met during vet school, but not at the same vet schools. But she's a veterinarian, and we met at a program in Louisiana, Aquamed, and she was from the West Coast, which is where I am right now. I'm on the Oregon coast. But yeah, we met at an Aquamed program after our first year of vet school, and fell in love, and long distance relationship. We both had established such core support groups in our veterinary classes that we decided that we would, stay put, not, get into the same school, which was a great decision. I mean, we're happy to have done it the way we did. We got married during our 4th year rotations during vet school, and actually went on a honeymoon during our rotations, believe it or not. But yeah, and also pet parent. I've got 4 little dogs, Pomeranian, 2 Papillons, a Chihuahua, only one cat right now, but 2 foster kittens. Foster kittens were actually one of our coping strategies during the pandemic. I think we did over 50 foster kittens. There's nothing like having kittens running around your house, but we just continued to take on litter after litter,
Wow.
and placing some of those with some of our favorite clients too, so it's kind of wild. But yeah, we've always got a bunch of critters running around, and we have chickens. We're down to 2 chickens though. So but yeah, so I mean, that's how I guess I would identify myself: father, husband, pet parent, veterinarian. I guess professionally, I'm a medical director at the clinic that I work at, Grove Veterinary Clinic in Newport, Oregon, which is Central Oregon coast. I'm also president-elect of the OVMA, the Oregon Veterinary Medical Association. So stepping up to president in March. And my platform is going to be what we're talking about today, well-being, keeping the conversation going, reducing the stigma of mental health, and really trying to keep the conversation going, and an awareness campaign on all of the things that we can do, and the program development, like Get Motivated. Yeah, that's me.
Well, thank you so much for sharing that with us. And kudos to you on all of your accomplishments personally and professionally. I know one thing that stood out to me when you were saying about how you chose your relationship with your wife is that you guys made it work long distance. Like, that's important. That's something that not everyone can do, and I think everyone's pretty familiar with the idea that that's a difficult thing to do, but that you guys each had the awareness back then at semi young ages to say our support groups are strong, and that's important to us, that those trump our relationship, and in a way, right? Like, the relationship is still there, but that you didn't, like a lot of 20, 30 somethings will do, and blow stuff up, like I've done, like, oh, let's we're gonna go this way. So kudos on that. Like, do you remember having that level of awareness back then, that it was like such a big deal to have that?
Yeah, I do remember it. I mean, and I think we just our relationships with the people we had met during that first year. I mean, we're like really rich relationships, and we both respected that for each other. But I do remember consciously, like I can think of my core, and I know her. We've got pictures of these people up at our clinic, we've actually even worked with them on different occasions in the clinic as well. Just so yeah, I think that we were very aware of the special group of people that we had met, and those relationships have maintained, our whole lives. But yeah, it is an interesting thing, and that's how I never have really kind of thought about it that way, but we did recognize the power of what we were part of, and did not want to give that up, even for love. Love will find a way. But,
yeah. Do you still have support now, like a strong support group where you're at now in your life and in your profession?
Yeah, definitely. And that's over the last 6 months, the way that I've kind of framed a lot of what we're doing, and I, I recognized it at the time, but I think we were just doing it. But when you really kind of reflect and when everything gets boiled down to, what are we doing? There's a real drive for community is something that's huge for us, but connectedness. And I know, Renee, you've talked about that a lot. But the belonging, the inclusion of the people being part of something where it's more than just the relationship, it's the purpose, and it's why we come together. And I think that one thing that I tell my team, when we have a meeting and we might be talking about why are we here, why do you work here, what's your purpose for, I always tell them, like, I'm here to be with you guys, and I'm here to enjoy being around you, enjoying being in this workplace and being part of this team. The team building part is priority 1, 2, and 3. Yes, we're doing patient care. Yes, we're taking care of clients. But in my mind, my primary passion is to make this team a truly tight, inclusive team that belongs together and have everybody feel that they belong in this group. And it's palpable. I mean, it's we have a good time. I like going. I like going to work.
I love
And
it.
they'll shoo me into a room to stop like doing dad jokes or talking about whatever, and
Oh, man.
random facts. If you get me on a spree of that, then they're like, you got to get into that room, Dr. Hurty.
Uh, now I want to get into somewhat of the origin of like your well-being journey and stuff like that, right? Because
Mhm.
it just doesn't come out of nowhere. It's typically some inciting thing or incident or mentor or person or book or like
Yeah,
program or something like that. But before we even go there,
yeah,
I think it's so imperative to talk about like the origin of like how the three of us are even here today, right now. And so, for those of you who don't know, Get Motivated has a veterinary burnout certification program. And we launched that program back in March of 2022. And to this day, we've had over 1,400 applications for
wow,
this program where people can earn their certificate of veterinary burnout preparedness. And Renee and I, we take the time to actually read through every single application that comes through. And so maybe it's about 4 months ago. I don't know when it was at this point, Charles. I'm forgetting when his application came through. But as I was sitting in this very seat reading through his application, I was just like in awe of everything that I was reading. It was probably one of the longest applications that I'd received, in a year and a half. And I was like, I have to call this dude. I have never in 1,400 applications picked up the phone and actually called an
wow.
applicant. But I just felt so impelled to drop everything I was doing in that moment. I looked at his phone number, I dialed it from my cell phone, and I called him. I think I had to leave a message.
Yeah,
I
yeah,
don't think you answered, but you did call me back.
yeah,
And we were probably on the phone for a solid 30, maybe 45 minutes, just
yeah,
talking about well-being. And we realized we had so many similarities from you going to NC State and me going to NC State and my wife being a veterinarian and your wife being a
yeah,
veterinarian, and then having this all-encompassing passion for just like well-being and mental health for veterinary professionals, for ourselves, and also for the teams that we work with.
I tend to get a deeper understanding of our students through the projects and the milestones. And it reminds me, I'm watching this show on Disney right now. It's called like National Treasure. And there's a young woman who can pick out patterns, and sort of like Iron Man, you would see this special effects where words are lifted off of a page because that's what she's seeing, and they're sort of illuminated. But that's what I feel like when I read your submission. Is there are certain words that I've used, that Quincy and I use frequently in our conversation, but it's not the vocabulary that we often use when we're talking with students, because it's just a different type of vocabulary. And so you use some of those words, and I'm gonna pull some out because I've selected some. But to have someone who, like I said in the beginning, I read people's stuff, and I'll call Quincy and I will email him and I'll send him text pics, like pictures, screenshots, and I'm like, I am crying. I'm like,
oh man,
tears
you
and
guys are too nice.
From different students, but to have us both feel so strongly, and it's not without merit though. Like that's, we're not just like blowing smoke, it's really remarkable.
And to that point, like, that's not to take anything away from any other applicant, because we've had so many amazing applicants who put in really awesome applications. But to have a leader in the field who is a hospital owner and a hospital leader and what really intrigued me about your application is that you understood the importance and the value of well-being and what it could bring to a team's culture, and you implemented it in a time where it was really difficult for a lot of people, not just only in veterinary medicine, not just only in your practice, but globally, right? And you were seeing the results of doing that. And oftentimes Renee and I think this is another subconscious thing that gets Renee and I really excited about you and your story, Charles, is that there are lots of veterinary leaders out there who maybe don't really see the value in investing in the well-being of their team. And maybe it's because it's hard to show an ROI, like a bottom line, like return on investment. But in your eyes, it was very clear. And so with that being said, we're going to get into that a little bit. Just tell everyone about like where your well-being journey started. And
yeah. Well, I think that I'll just kind of walk through a little bit of so it all kind of came to me. It all kind of started in COVID. I mean, we were, the world was turned upside down, and on top of that, just all the political division and the anxiety and the stress of the world, and we, as a team, I think as a veterinary industry, the ecosystem, I think we rallied for a bit, right? I mean, that's what we do. We work with little bits of information all day long. We try to, do what we can do, and we figured things out for a bit, but then it just got even harder, right? Because you're watching the images on the TV, people are dying. We're going to work. We don't know, like, are we going to die? So obviously that notched everybody's stress level up, way up. And so I had always looked at well-being even pre-COVID, and we're actually putting together some programming, the best that I could as far as, awareness, resources, but it was more like that. It was just providing some resources. AVMA was starting to do some work with that, and so was AHA. And then, when COVID hit, it obviously kind of reframed everything for us. we pulled together as a team pretty tightly. I mean, it was our gut instinct was, Natasha and I, our gut instinct was to build this connection to move through this as a team. And so we doubled down on that. And we basically had a lot of, smaller huddles and meetings. We said, look, there's no playbook. We're hearing from so many different sources. We're going to move through this together. And you guys just need to tell us, what you need, what's working, what's not working, how are we going to do this? And we really kind of opened up the forum to you. If you've got an idea, we're going to do it, because that's what we're going to do. and you guys we're going to own that idea, and we're going to rally around that idea. And everything from our curbside signage outside to someone wanted to get artistic with chalkboard and chalk paints, and we got creative with texting, and everybody. That was not just us pulling all that together. So we invited a very collaborative spirit to move through, and that's great. That was working. We were doing it. And I noticed, though, as time moved on, maybe we're a year in, or let me backtrack just back to September of 2020, because here we are on the Oregon coast. And this is where sort of we'll probably come up our grit plus love concept. That's kind of what we call it. That's our kind of our culture. But in September, so we're doing curbside. We're in the midst of COVID. We had the skies here turned orange. We had fires. Like we had a very strange weather pattern, high winds. It almost kind of mirrors what they experienced in Maui. But we had these forest fires on the eastern part of the state, and then these high hot winds that kind of blew towards the coast. And with it came burning material. And so we had forest fires for the first time. We had soot and ash falling from the sky. It was the weirdest thing. So we're continuing to do this curbside because this all happened very fast. And we're wearing our masks because we can hardly breathe outside. We're taking the pets outside and we're coming inside. And I'm like, so during that, and obviously we closed early that day, but I pulled everybody into the treatment area and I said, you guys are the grittiest group of people I've ever met. Like, I wouldn't want to be doing this with anyone other than you. And that's where sort of the grit part of our grit plus love developed. And we did find, we did have one of our team members, her mom's house burned down. So it was touching close. It was close to home, that situation. We took in animals that had been retrieved from the fire sites, and a lot of cats with burned paw pads, so a lot of wound care. And but the team, that was a purpose, right? That was something that we could rally around and do, and we were able to do that. And so then fast forward, we get into 2021, and you could see things were starting to not fall apart, but the emotional toll, it was starting to get to us. And I could see in the team that we weren't losing the battle, but it was getting harder and harder. And for me, for the first time in my life, I felt like, and I don't know if I have this written in the application, but it might have come up during some of the projects. But I think Quincy and I, we kind of bonded over this too. Like, I prefer medicine and being in the room with people, and Natasha prefers surgery. I'm okay, I can do my surgery thing, but what I found was my brain was so distracted during surgery, which is, you got anesthesia going, and of course I've got a technician with me, but I was so distracted that I felt like I couldn't be completely present for the patient. And I'm like, I don't think I can do this. Like I'm not doing my best for this patient. And if something happens, I'm not sure I can cope with it. So for the first time in my life, I actually felt a little paralyzed, a little paralyzed by that. I actually admitted like, hey, I can't do this, you know. And so feeling that, I thought to myself, okay, if I'm experiencing this for the first time and all this stuff is going on around me, I need some help. And so I looked into all the webinars and all the different kind of podcasts to, search for some answers. And I learned all the neuroscience, the amygdala being overactive and the stress cycle not being able to end. And I'm like, okay, I identify, but what do I do? I was like, that's great. Like, you guys are telling us what to do, right? And so I did come across a podcast that was talking about trauma. And I was like, okay, like this, I identify with that. Like, I think the whole team is experiencing trauma. Veterinary medicine is hard enough as it is, but throw all these other things into the mix. And okay, I think if we frame this as trauma, what's the next step? Oh, therapy. So I was like, okay, I contacted my primary caregiver and I said, hey, this is what's going on. Got a referral to a social worker, and it literally changed my life, right? And Helen's fine for me to mention her name, but Helen Beeman, we just actually had a session with her 2 weeks ago. So Helen, she was my social worker. She introduced me to cognitive behavioral theory, and the way that CBT can really, and it's scienced up, right? It's not, it's like proven. And it's doing stuff with your physiology, and it's having an awareness. And I learned a lot of, I was starting to learn things about myself that I probably knew, but just didn't really, I've lived with anxiety. I know I've had some anxiety, but I think I've hijacked my own anxiety since college. I would create anxious situations to become a high performer. And so we made progress pretty quick. Like, I engaged with her very quickly. She got through to me very fast. And then I just had this like, wait a second, if I am having these kinds of results this quickly, what about the team? Like, maybe this would be something we could use, at least a perspective, and bring her to the team, and let's develop a program where maybe, it's just validation, validation and the provision of the vocabulary that we need to describe what's happening to us. And we just got so lucky because she is a pet parent. She has a dachshund. She's got a cat. She's very passionate about her animals. And so she got it. She understood. And she was pretty new to our area. But she was definitely the person to run into for this. And so I shared with her information from Not One More Vet and from a couple of TED Talks and some literature from the Merck, well-being study. And then we went from there. We introduced this to the team, and I did bring this idea to the team in a very not pushy way. I wanted people to understand what we were doing, that this wasn't a therapy session. It wasn't going to be, necessarily sharing our feelings. It was going to be whatever we all wanted it to be. And I'll tell you, we got, so it was a completely voluntary program. We got 100% participation, and we did offer food. We rented out a bakery, and it was fully catered, and cupcakes and cookies and cake and all of that for dessert. But
Were you
everybody
surprised?
came. What's
Were you
that?
surprised that you had such good participation, or
Um,
was that, or were you
yeah,
anticipating that?
I was kind of hoping for that. I thought maybe there was a couple, three people that might not show, but everybody showed. And we ended up doing 4 total programs, starting in July 2021, going through October. And each one had its own kind of take, but it was life changing, and it was life changing for the team. And I just think that first session, we'll call it, or module, it was just the recognition of, and the validation of what we were going through, and then to frame it as trauma, you know and to hear like, hey, you guys are all type A perfectionists. You're trying to fix this you're trying to fix your brain with your own brain, and it's just not going to work if it's too heavy of a situation. And it just provided a major outlet, and there were tears. It was a safe space. People were overwhelmed, but she provided that validation and that language. And then what we did is we moved into strategies, right? We moved into sort of like some coping mechanisms, and some of it's just so easy, but the key message too was there's a lot of different ideas. Not everyone is going to resonate with you. Try them on, see what works. If it doesn't work, try it again. And if it's still not your thing, move on to the next thing. And don't expect the whole world to change. Well, the whole world did change, but don't expect your whole world to change in one day from learning this new skill. It takes time. It's a practice. I think you guys talk about that too. It's like, building muscle. You got to continue to practice this stuff in order for it to take an effect and to become part of your normal routine. And some of
Well,
the things that worked were, you're like, wait, what? how did that work?
and I want to pause here for a second.
Yeah,
I
yeah.
know Renee probably has some commentary that she wants to add, and mine is going to be fairly brief. But we have a lot of leaders in our community, like practice owners and practice managers and chief of staffs and medical directors and things like that. And I think that one concept that I heard you mention is that there were 3 people perhaps that you maybe thought weren't going to participate, right?
Mhm.
And I think that there are probably leaders who will halt an action and not do a thing because they're worried that the 3 people might not come, or might have a problem with it, or may make fun of, something like that if we actually do it. So I just want to say kudos, number one, for actually moving forward despite not thinking that everyone was going to like the idea or everyone was going to want to be a part of it. And so if you are a leader out there and you're listening to this right now, there may be half the team that you're thinking isn't going to want to be a part of it. There may be 75% of the team
That's right.
that you're thinking that it's not going to want to be a part of it, but you won't know 100% until you go ahead and do the thing that you think is important and meaningful for somebody on the team. It doesn't have to be like 100% everyone wants to be a part of it. And again, sometimes our brains can psych us out and say, well, well, Charles, don't do it because the three might not come, right? And that's just our ego oftentimes saying,
Yeah.
this is maybe something you shouldn't do, but you have to push through. And if you know it's the right thing to do, to have a well-being mental health program to support your team members, then just go for it and do it, right? And even if
Mhm.
no one shows up but yourself, I think that still sends a message to the team anyhow. And you may be surprised, and maybe everyone shows up. So that just go ahead and do it anyway. That's the thing I want to say to all the leaders out there is do it anyway.
Yeah.
Thank you for that pause too. This was one of the podcasts that I wanted to almost be like a news anchor and have like legit notes, because I knew I would have so much in my mind. And even being present in the conversation and listening to you, I didn't want to lose trails. And so because of your ability to connect the dots, that's one thing that you talked about in your last project, is
Mhm.
that had this wake up moment where you're in surgery, and then you connected the dots between a few things happened in that time period, and part of that is that you recognize the ability to step back. Like, I can't do this. I'm not going to force myself to do that. Before I move on to my next sort of bullet points, do you think if you were an associate veterinarian and you were in that position where you could recognize this inability, do you think that you would have been able to step back in the same way that you were able to in your current position?
Um, it's a good question. I would hope so. And so our culture right now, and always, we'll just use the example of surgery. I did have an associate who was not interested in surgery. And so we said, you don't have to do surgery. We just turned her on to, ultrasound, and some other skills that she could utilize and not be tied to a surgical schedule. She would do a wound, from time to time, because she was the only one there to do it. But there was, and we had a conversation about mental health, and this is years ago, and that was a significant player, and so we just made adjustments. Now that's my philosophy, and I know that leaders in general, and me too, we all kind of overestimate our approachability. But I think that if you're an associate, hopefully you are feeling like you're working in a safe enough space, in a safe enough environment where those concerns can come up, and it may be a conversation to have. Maybe there's additional CE, there might be some other suggestions, but to have it be a conversation, but to hopefully feel comfortable enough to check in with that and bring it up to the people who are making the schedule.
Yeah. Thank you for that. That's something that Quincy and I, we worked at the same clinic. That's how we know each other. We've shared that not dislike, but just it's not our passion area.
Yeah.
And so I'm not a veterinarian. Most of our listeners know that, but as someone who, like, again, capable, can I do the thing? Sure. Do I like to do the thing? No, because much like you, anxiety wants to start driving. And the longer I spend in this career, it was like, why do I have to do the thing? If it's making me utterly miserable. But I would have people who would try to change my mind about that. And sometimes that can be uncomfortable, but I think, you brought up vocabulary. I think that's really important. And then also just that introspection of like, what is it that it's sort of what's happening in me that's during those times, and then having the vocabulary to explore those conversations, whether you're in an ultra supportive environment or whether you're in an environment that's like so, or if it's just, you know that you're going to approach pushback when you bring that up. But to Quincy's point, like still do the thing, like don't just not have that conversation. So you know, you brought up the hijack, like how and most veterinary professionals share similar traits in our personalities, of the people who are high performers, who are type A. And sometimes, especially if you haven't done a lot of, whether it's personal development work, introspective work, or like therapies, you might not recognize the tendency to where it's not serving you. And so it starts to work against you. So I think that's really important, you know. And I actually, I'm not sure if you read this. I think I mentioned it in my feedback, but
it's on my bedside table.
It is, isn't it? Like, I want it to be a coffee table book where, I mean, I'm in a house of boys, so that like, who don't, I'm in a room of boys right now, but who do speak this language, but my boys don't speak this language, but I want them to be able to speak this language. Because it gives us a language to speak about these things. And so when we talk to the listeners here, there are some words that Charles had mentioned that Quincy and I use, but I just want to introduce them to you guys in a new way. And some of those are, like you said, trauma, hijacking, trying things on. I actually did some presentations at conferences where I would put up slides of people trying clothes on, because that's what I want people to do in our presentations, to where they don't dismiss me as a human being, they don't dismiss the session as a whole, or they don't dismiss this topic area as a whole, to be like, oh, I went to that one session 7 years ago and it's just not for me, you know?
So
I think trying it on is really important. And then we'll get to this when I'm going to hold it. But your ability to ask for help. I cannot remember what I was just reading, but it was talking about when we are trying to equip people with new skills, the ability to ask for help is one of those skills that we need to normalize, regardless of our jobs, regardless of our roles in life, regardless of our genders. Like, that skill in and of itself is paramount, and can really make the difference between, you know, a subpar life or a life that's sort of extraordinary. So just fantastic. And I wanted to pull those things out. And I appreciate you letting us know what the program sort of looked like with your mental health provider, because that's something that a lot of vet professionals have reported, that when they go to someone, they cannot seem to relate in the way that they need to relate. You know, with Dr. Feldman, he gets us, and I think there's reasons for that based on his background, and how you're talking about Helen, you know, being able to sort of get you in a new way. That's just so important. And then to know that, it's funny that you say 4 parts, because when Dr. Holly and I work together with a group, like an organization or a group of hospitals, things like that, we typically will do quarterly as a really great entry point, because for whatever reason, it's that wave where you can introduce certain things, and then people have those 3 months to sort of ride that wave or try those strategies on for size, and then get into another session and go, okay, what's next? So we paused on the strategy. So when we kick it back, Quincy's got something to say there, but when we kick it back, you had mentioned that some of them were really simple. So I'm curious, like, what were some of your favorite strategies that you guys used organizationally?
Yeah, I could definitely go into a couple of those things. And I think the most which we made fun was reframing language, and how we can communicate about, maybe a less ideal situation. The example that comes up a lot is, angry client, right? So rather than, storm into the back treatment area announcing that we have a, really angry client who's really mad and getting, is to come into that situation, making someone else who needs to be aware of it with, we have a less ideal situation up front. We've got a client who needs some, assistance. So that we're not like, the first approach is like, oh, we're all tightened up, we're all anxious, we're already taken over. Our amygdala is like, I'm already in protective mode. And that's a hard way to approach that situation versus, the secondary way to present that. We're looking at a solution. We're going to try to be responsive and not reactive. So the language part was very fun for us because we I don't know, it became kind of like oh, I've got a less ideal situation happening, or but if you can laugh about something, or at least relax your body and get your face muscles that make a smile, if you can get into that and lead with that, you're already 2 steps ahead of approaching that scenario versus trying to be tense and angry and avoid and fearful. So reframing language, but then reframing opportunities. And it's hard, man. I mean, like, to look at that client situation as an opportunity, it's hard. It takes some practice, and it takes a couple mistakes and a couple failures too. But one of the things that we also that kind of evolved from that was approaching situations with curiosity, right? So and we teach curiosity. It's one of our major cultural mottos is to be curious and not judgmental. And your curiosity can take you into some pretty funny places too. Like, one of the things one of the examples that Helen had actually used was like, she's like, yeah, I get really angry if somebody cuts me off on the highway and I'm angry and I'm cussing or whatever, I'm really getting, bothered. So, they're saying, oh, that person's just a jerk, so you're really judgmental, you pass it on, but you've also generated this kind of negativity. But if you're curious about that person, like, oh, I hope that grandmother's okay, or maybe that person really has to go to the bathroom, and they need to get to that rest stop quick. Maybe you laugh about it instead of turning red about it. So curiosity and reframing how we approach some of those less ideal situations was very impactful for us. And it resonated very quickly because we had, with curbside care, it was very easy for us, and even now, right, to become sort of this us versus them mentality. And you kind of have to be careful of that. You do want to have your team and you've got everyone's back on the team, but the clients are paying the bills, and you don't want to have a lot of friction there. And so teaching that curiosity and being connected, but building community. And we always refer to our clients as our community. So those were some of the more impactful strategies that we learned as a group probably one of the most impactful things that I see people doing is, we went as far as meditation and square breathing, triangle breathing, deep sighs. So we do have a lot of triangle breathers, square breathers, and deep sighers. I'm a deep sigher. I will at night do a triangle breathing if I get, woken up and I need to relax back to sleep. But in the day or the clinic, and we recognize those strategies as they're being practiced.
In 60 seconds, can you tell us what a deep sigh is? Like what is that?
Oh, it's just like a, with purpose though, right? It's like
Okay.
so you're mindful with what it is. It's a clearing. It clears the mind, brings you back to like right now versus 5 steps ahead of the game. I'll even do a you got this to myself along with that. And it just brings you back to now.
For sure.
And allows you to sort of chug along, I guess, so to speak, or to approach.
So is the deep sigh a little bit different than
yeah, it's not the disgruntled groan.
Okay, is that what that was called? I gotcha. Okay, very cool. But those little moments though, they really do help. And when you start to add those up, maybe there's 15 people on the team in one day, and if there were 15 people who were gonna have a disgruntled groan, and they all turn those into deep sighs, and collectively we're in a very different energy state of mind as a team, right? We had 15 intentional deep sighs as opposed to the more negative, like disgruntled groans. And to your point about the traffic, right? Like it sounds fluffy at times when you're like, the grandmother, or maybe they really had to go to the bathroom, but the truth is, like, we really don't know, right? So that it really could be the grandmother. It really could be like, these aren't just things we're telling ourselves. And to think that it's some a-hole just wants to cut me off in traffic and ruin my day and put other people's lives in danger. It's really no different to think that versus thinking that it could be someone who just really has to go to the restroom, right? Like, one's a more negative thing to think, and the other one's a little bit more positive.
And that biofeedback to double down on those things. Like I was just telling you, Quincy, about the things that I will have imaginary conversations that do not help my physiological state, nor my mental state or my relationships or whatever reality I'm in my head.
Right.
And so there's times where I'll just change the train of thought. And if I'm going to be in my head in whatever imaginary land this is, to choose it to be positive, and to open up the heart to curiosity or to positivity, to love, to let in a different type of thought, a different type of energy, and then use that biofeedback to go, like, you can feel it in it.
And for me, like, it's not about like just being some happy-go-lucky person. It's about performance, right? I really think it's about performance. And as a veterinary professional, when I'm seeing lots and lots and lots of pets or lots of owners or whatever it is, or difficult cases, if I'm in the state of mind where the deep sigh as opposed to the disgruntled groan, then I know I'm providing a higher level. I'm more capable of providing a higher level of client or customer service, as well as like patient care, if I'm in the more positive frame of mind. So for me, it's all about performance, right? Like, and just realizing that I'm going to do a better job if I go this way as opposed to this way, right?
And if you're curious, like, you can sometimes, especially with clients who, they're only there for a short period of time. And so there's so much going on. Brene Brown actually talked about it. since the pandemic that the world is just emotionally dysregulated. And for us to not give our clients that same permission that we are giving ourselves, which is that life is chaos, I am chaos, like it gets in the way. And so to have a mind of curiosity, a mindset of curiosity, it can lead you to better patient care, because you ask certain questions that if you were being judgmental, you wouldn't have asked. And you might get to a reason like, their grandfather just passed away, and this isn't even their dog. This is why the medical history isn't as robust as you would want it to be, or this is why the money is weird because, they got the dog yesterday. It's not that like they're just mean people who don't know how to budget for their dog. Like, you shouldn't have a dog, then, like you hear that from clients. But it's like, what if you just rescued it from the forest, or whatever the case is? Like, just being curious can help us do our jobs better, but also feel better about doing our jobs, and then, connecting with your team and stuff like that. So,
and that can be a hard thing to do. But, one of the other examples we use is like, well, you've got a client, they're in their car, they've got 3 kids, the dog has diarrhea, dad is out on the fishing boat making a living, mom is sick, all these different things. Life is happening to that person too. And to lead with it being a less personal, it doesn't have to be like, let's just be humans, recognize each other's humanity there.
And because it is hard, it gets easier if we're all doing it. Because like Quincy and I, like, we get to have these conversations between the two of us, but our challenges and our problems don't stop just because Get Motivated exists. And so, but with you guys, like, that's the really cool thing, is that if the whole team is attending these types of programs and is all utilizing the same strategies, vocabulary, or like you had mentioned, my other word that I wanted to bring was infrastructure, it makes it easier, because there's going to be a day where Renee is not at her best, where life is happening to Renee, and it's harder for me to reframe that. And so I have to come to Charles and go, I know this is in my wheel, like I can do this, but I can't seem to do it right now. Help me out with this situation, because I'm struggling with it. Normally, like if I'm sick, or something like that, like my capacity is like lower to handle things with a really thoughtful response. Right.
Great points. And I know we're coming up on our time here, but I do have one question for you, Charles. This is probably my last question before we get to the final last question. But buy-in. So you were the leader, and you were really excited about well-being and the mental health stuff, and you brought that excitement as the leader to the team. How important do you think understanding the value of well-being and being passionate about, or as Renee and I like to say, a practitioner of what you're bringing to the team, like how important do you think that is in terms of gaining buy-in from the team?
I think that a lot of things there. So getting buy-in, it starts with trust, right? So you do, putting a program like this together solidifies trust. But we had done enough and showed a commitment to the team. Like, we truly have your back. We're in there we're leading from the middle. We're moving forward as a team. So I think establishing trust as a leader and building a culture that is a true, genuine, as Brene Brown would say, wholehearted culture, will make buy-in easier, I believe. But I also introduced the concept over a several week period of time, sort of, and I had done some work trying to figure out some stuff. So I had a little bit of like, this is what I know, this is what I don't know. This is what I think the team needs. And I may be completely wrong, but let's try it. If you guys want to come on this journey, let's do it. It's not going to hurt to show up. We're not going to sing Kumbaya. This is not like a forced therapy session. It's solutions, and and it's done a lot for me. And we've taken this sort of unique perspective, and let's, if you guys want to be part of it, but I totally invite you to come and do it. And and if it's not your thing, that's cool too. So I think in terms of, I did show some vulnerability in talking to them about my own needs and what this kind of thing had done for me. But I felt like the team needed something, and this is what we came up with. And I guess in hindsight, it definitely changed my life. It put my whole life on a different path in terms of the approach to well-being and just life in general, honestly. I'd like to say our team is very unique in that, I've got posters all over the clinic and wellness techniques, and we call ourselves, we identify, you probably have seen these bracelets, but I have this is the second series of bracelets that we have. So we identify as badass gritty unicorns, with our grit plus love here. And we roll with that. We do some cultural things that are super fun, where we have a unicorn named Taylor, yes, named after Taylor Swift, that we hide throughout the clinic, and we all look for that. And you're never really looking, but you're like, oh, look, it's Taylor. And then we have a
Swifties.
Group where we have a group text where we share hey, here I am with Taylor, and I found her. And so we try to have fun. And I think what we have found through the programming is that we are truly connected. We all do belong. We really work hard to make people feel like they're part of our team, and we do have a lot of fun. And I think if you're feeling safe, you're going to have fun, right? If you're feeling like you're in a place where these kinds of conversations are normalized, you're going to be more resilient. You're going to be able to adapt. You're going to have people that are going to listen and help you. And Quincy, you mentioned performance, and I think that's one of the key things. So I tend to think about efficiency, and you can use the word productivity or performance, but I think that those terms should be redefined as wellness terms, because the more efficient we are, the less, and it can be emotional efficiency, but just operational efficiency, the less time wasted, the less frustration experienced. Again, the happier we're going to be in our workspaces. And it sounds very money-like, but I think it needs to be reframed a little bit. It's and that's where you want, if you've got people who are feeling good about where they are, and they're not in constant chaos, right? And they're not in constant emotional reactivity mode.
Yes.
They're going to be more innovative. They're going to bring ideas. The team's going to function better. And that leads to efficiency. And if we're able to leave work on time, that's a definition of efficiency as well. and
Yes.
staying 2 hours late to do medical records or whatever it is because
Right.
something wasn't working or you know, but I think that ties a little bit with your performance
Yeah.
comment in that you're going to be your best self if you can move into these more functional mindsets and avoid the dwelling, right? I think it was
Yeah.
Renee had the dwelling in that negativity. I think as part of the training, I was like, yeah, that's you don't want to go there.
Right, right. And I think a major part of it for me too is uh, um it helps me to avoid burnout,
Yeah.
because when you take that higher road, there are less unnecessary stressful moments, right? I think
Yeah.
a lot of the chaos and the stress that we face in the veterinary clinic is unnecessary. Like some of it is unavoidable.
Mm-hmm.
And then a lot of it is like created in our own minds, created through the lack of ability to understand the clients as human beings who have lives and things like that. So you internalize the things that they're saying and doing and the way they're behaving. But so that's also what I mean by performance, right? Is that it helps me to be less burnt out so that I can enjoy my role as a veterinarian and a veterinary caregiver. So thanks for all of that.
I know CVBP is a part of your puzzle, right? You found CBT before you found our program.
Mm-hmm.
But it seemed like you had some pretty big breakthroughs throughout it. Do any specific results? I'm curious also, like you had mentioned, you had a lunch break initiative that you were starting, whether it's personal or whether it's organizational, like certain results that have really stood out to you over the course of you being part of the CVBP program, or where do you feel like you would be if you didn't have this part of the puzzle?
Yeah, that's a good question. Would something else have taken that space? Um, it's hard to say. If I hadn't really thought about getting help and figuring out the whole surgical thing, would that have, there's the possibility that could have, you know, escalated or moved into some other aspects of my life. Um, uh, so I do feel like the understanding that theory of your thoughts and your beliefs and your emotions and your actions, it's a great framework for trying to understand what's happening and how you can, intervene at different spaces um, to make some positive change. Um, I don't know. Like I don't know if I, what I feel like I probably still be slugging away in a different way, I guess. Or would another year of doing that curbside care, it's hard to know, um uh, but I've definitely collided into a really tremendous system. And then I continued to try to expand upon it and continue to communicate and write about it. Um, but yeah, I probably wouldn't have found the time to get involved with OVMA. I do some newsletter writing as well. So yeah, my life would probably be very different if I hadn't found it.
Well, thank you for sharing that. As someone who is busy, in all these different roles that you have in your life and work, do you have any tips for people who decide to
Yeah.
invest their time, into
Yeah.
projects like this? Like how did you stay motivated to graduate? You earned your certification in a, relatively short time frame. What kind of things inspired you to stay engaged
Yeah.
and moving through?
Yeah. Well, I definitely I just devour this type of information. And then, oh, there's my daughter's getting home from her swim meet. Uh, I find it fascinating. And so I am constantly wanting to learn. And that's something that you guys definitely talk about. And we're definitely aligned there. I think that as far as advice on this kind of thing, I feel like this is definitely something that we're probably all thinking about is how do you take that person who's like, wow, this is cool. How do I get it going in practice? Or how do I take the next step? And it's the going to the CE, right? And then it's going back to work. And then it's just like a collision of like, oh, it's work. And it's just like, boom. And here goes all my fresh ideas. I think trying to approach that situation is you don't need to change everything. You don't need to do everything you learned at the CE. You've got notes, you've got, you've taken the notes and you've got the materials, but just pick one thing and start. And you might be very surprised at how just one thing makes a huge difference. And you also then might find a colleague who's like, this is really cool. What are you doing? Now you got two people. And then you guys figure out what's the next step. And that is a very hard place to go from contemplation to action. And I think as veterinary professionals, we like to fix things and we like to get in there and get it done. And so it's very hard. It's probably hard for most humans to think about going in, making one minor change, moving forward slowly, figuring some things out along the way. I mean, and it's not, the other part of it too is that you're going to run into some resistance as well. And in that there's some generational differences that are very interesting. And I'm sure you two have in your presentations encountered all kinds of different pushback from different people. The boomer generation's a little bit different from the younger millennial generation. And this is an area, I think, where there should be a lot of curiosity amongst the generations to try to figure these things out. But clinics right now, we've got, folks who are in their 60s, 50s, 40s, 30s, 20s, teenagers. So this is a huge stratification. So that can also feel like a barrier to getting things going, but just stick to it. And again, just one little thing, and then let it build from there. But that is probably the hardest part is meeting some of that resistance and then kind of folding or coming in and wanting to do too much too quickly. And just kind of picking something that will work. And, I presented information, some of my training to a group. And, one thing that a couple easy steps that I provided to them, and I love this because they send me pictures and show me, is, we at our clinic, we all wear crazy socks. I mean, we wear crazy socks every day. The crazier, the better. Colors, swear words, whatever it is. And we'll if it's like a moment, like, hey, all right, it's time for a sock pick, so we'll get together, we'll put our foot out there in the middle and we take a picture of our socks but people are, that's sometimes the first thing of the day. Hey, what are you wearing today? That's a cultural thing. And it's so easy. Like it's socks. But you know what? People laugh, they're smiling about it. They're showing off their socks. I mean, it's easy. And the other thing that we did that other clinics have done and given me feedback on is we made these glitter globes. And the whole concept of this glitter globe, it's just basically sounds like it's a jar with soap water and glitter in it. It's a grounding object, right? And so one, it's a team project, so you can get everybody together and make a whole big mess with glitter and whatever. But who would have thunk that I would have a glitter globe on my desk for the last 2 years? And I pick up that glitter globe and I shake that glitter globe before I have to make a tough phone call, or I have to break some tough news. Maybe I have a a sigh while I shake this glitter globe, but who would have thunk? And that was easy. And they have glitter globes in reception. And again, it's not for everybody, but the
Sure.
existence of a jar full of glitter um, is something. And maybe it's hanging signage. Maybe it's having a whiteboard where you can do a quote of the day. I've got a great team member, Amy, and she's taken it upon herself to put on the top section of the whiteboard that's not being used. She puts tongue twisters and random facts and questions of the week up there. That's fun. I mean, but it's easy. And again, it's a culture thing, and we all are waiting for her to put up the next one. So those are just some little baby steps that can be taken, or have a unicorn or some kind of fantasy animal that you hide around the clinic. Those all take the load off sometimes. They can definitely lighten the emotional weight of a day, and just have a chance to do something fun like that.
Yeah.
Are you optimistic for the profession?
Oh yeah, for sure. I
Why?
think in the last in the last year, right? I mean, the conversation's definitely more normalized, and I think it got I don't want to use the word hijacked, but the whole wellness thing got a little bit commodified almost, to the point of like, oh, no one's going to listen anymore because we're using wellness to sell everything. But I feel like it's all kind of boiling down to a core, like you guys are on it, burnout. That is a framework that makes sense. And I think people identify with that word. And so and I think well-being is going to stick. Well-being, burnout, and I think the cultural part are going to be the words that really move forward in education programs, and programs are built around those words and those terms. At least that's how I'm seeing it. And so I think the conversation is here to stay. Being part of OVMA, we're meeting this Sunday to put together our stance and program on well-being. So we're going to be an organization that's, and I see other VMAs that have put together programs to become part of the conversation. So I think it's here. I am confident. It's just going to continue to take a lot of work. Getting more people through, get motivated, and programs like that. No, but I think we're going to be okay. But I think that veterinary medicine is going to look pretty different in a couple of years, just in terms of for the better. I mean, I think we're gonna have a boundary setting. It's going to be a healthier environment where this is going to be part of the conversation. Veterinary schools are starting to embrace this kind of training as part of the curriculum as well. So I think we're going to be fine. I think the skill sets are going to be there for us.
Well, I
Awesome.
appreciate your, I appreciate your outlook and everything that you've done up until now for, especially when you can see the difference between like wellness and well-being. Again, that's one of those things like that's just inherent to you, like you being able to pick some of these things out, that is just a little bit different, but that clearly aligns with who Quincy and I are, and Motivated's mission. Things that, trying to look around the corner and provide sustainable solutions to things like that. So I appreciate you being here with us today and sharing, being so open with us throughout this whole process. And even this 90 minutes, like we could talk for days.
Yeah, right.
And I do want to know, Charles, if there is one final message that you'd like to share with the Get Motivated veterinary audience out there, one piece of advice, or
Sure.
word of encouragement, or anything like that.
Yeah. Yeah, I know you'd had that in the email, and I've been kind of thinking about it. And I think I'll just reflect on some advice I was given to one of my associates just the other day. Was, break up with your perfectionist. Perfection is not an ideal situation, and it really can contribute to burnout in a major way. So embrace a little bit of messy. Imperfection is okay. And I think that's a hard bit of advice for a lot of folks to grapple with, but I feel like I don't want to say it saved my life, but it definitely changed my life in a positive way. Because if you're striving for perfection, it's never going to happen, and you're just going to exhaust yourself trying to get there. Maybe that's the quote.
Parenting has helped me like embrace the messy in more ways than one.
Yeah. And the other one is not my quote, but I think this applies to you guys too, and it's a Margaret Mead quote, and I'll read it so I don't get it wrong. But it's, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. And I mean, if you don't try, it's not going to happen. So that's one of my quotes that I really like.
Thank you.
I love it. I love it. Well, Charles, keep doing amazing things for yourself, for your team, for your family, and for the veterinary community, for the society in general. I love the passion that you have for what I believe is one of the most important aspects of us having a sustainable and effective veterinary future. Basically, if we don't get this right, then there are a lot of really, really, really challenging times ahead. And so keep sharing that stuff, man. And if there's ever anything that we can do for you, or the OVMA, or anything else, you don't hesitate to let us know. It would be our honor. And thanks again for your time.
Thank you, guys. It's been a blast to be here and have this conversation. I've been waiting a long time to have it, and is awesome. But I am on LinkedIn, and yeah, we're Grove Veterinary Clinic in Newport, Oregon, and I love to hear from anybody who would want to reach out. I feel like I've met some pretty amazing people throughout the last couple years on this journey, and I feel like I've learned a lot from the people who do reach out or want to connect. And so, yeah, I totally encourage that.
All right, you guys, have a good rest of the weekend. Enjoy the holidays. Hopefully one day we'll all get to meet in person, and we'll take the next level. But it's been so fun to have this conversation. So thank you both for taking the time out, and thank you to the listeners for tuning in and going with us on this journey.